Will valerian root help you sleep? Well, the answer is it might, but it also might not. Let me explain. And you'll want to hear and watch to the end because I'm going to explain the data that we have about valerian root, also potential side effects, potential benefits, but also ways to get a really good night's sleep that you don't want to miss. Guys, I'm Dr. Jen. It's good to see you. Valerian root. This is an herbal sort of medication or supplement that we are seeing on the market a lot lately. Valerian root has been used forever. It goes way, way, way back into the day. People have been using it, so it's not a new thing, but certainly in supplement form, a lot of people nowadays want to take it to help with sleep or anxiety. Sort of mood issues, things like that, sometimes even menopausal or perimenopausal symptoms it's being marketed for. But sleep is a big one. Now, let's talk about the data. As with most supplements, vitamins, herbals, etc., we don't have a lot of data. We don't have enough data, okay? Why? That's a whole other video, but that is where we stand. I do have to tell you that I have been impressed a little bit with some of the data that we have about valerian root because at least we have some randomized control trials, which is one of the best types of studies that we can have. So that's a good thing. We do have some randomized control trials, but we don't have enough and we don't have a lot of good data. But suffice it to say, and I'm sorry I keep messing with my hair, but it's just doing funny stuff. So please don't at me because I'm sorry. But with some of the randomized control trials that we have and some of the other studies, um, in some cases, people have found that they either fell asleep faster or they slept better in general, okay, which is good news. However, the opposite is also true with some of the trials as well. Some of the trials we have show that valerian root didn't make a difference or there was no improvement with sleep when it comes to valerian root. And that's why I say, in terms of valerian root helping you sleep, well, it might, but it might not. Now, this doesn't mean that you can't try it. I'm not here to be a Debbie Downer and to say, no, 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 no. I'm here to say, well, you got to talk with your doctor. And I know you're going to say, well, Dr. Jen, doctors don't know anything about herbals and supplements. Well, we know probably more than you think, but even more so, sometimes we know the bad things that can happen that we have to safeguard against for you. Okay. So now, let's talk about some of the things that valerian root can do. Again, I mentioned that in some people it does help with sleep, but there are some people and some data to suggest that the problems it's supposed to fix, it may cause. So in other words, some people have experienced sleeplessness with valerian root, okay? Also, there can be side effects, as there can be with any medication, prescription or not, as well as any pharmaceutical, herbal, supplement, etc. Any and everything can have side effects. Some of the side effects can be things like headache, dizziness, stomach issues, and sleeplessness, I mentioned, and other things. Now, there are some interactions. My source for this is the NIH. They have really great sort of fact sheets about different supplements that I encourage you to Google, like NIH fact sheet. One of the things they say is that there can be interactions with things like St. John's wort, kava, melatonin, and as you know, melatonin tends to help people go to sleep. Also, there's another caution against prescription medications that could be thought of as either sedatives or sort of depressants in the sense of causing you to fall asleep, become sleepy, drowsiness. So things like narcotics, things like sleep aids, things like benzodiazepines. All of those medications, it's suggested that you use caution or do not use valerian root with those because theoretically the potential effects of those, the sleepiness, the sort of sedation, etc., could be exacerbated, okay? So that's important to keep in mind. Also, alcohol falls in that same role, okay? Now, you should also know that while some of the studies show that valerian root helps with sleep and some studies does not, you should know that in 2017, it's the 2017 Clinical Practice Guidelines from the American Academy of Sleep Medicine. They actually recommend against using valerian root for chronic insomnia. So I think it's really important to understand that. Now, valerian root, I think, is interesting. I mentioned it's an herbal, and I thought this was sort of neat that what's actually used in forming the tablets or the capsules or the supplements, rather, is the root, the underground stems, and the horizontal stems. So that's, I think, really interesting. And then, of course, those ingredients and perhaps others are used to make the tablets, the capsules, the supplements for valerian root that people take, all right? Also, remember that supplements and vitamins and things like that are not tightly regulated by the Food and Drug Administration. So that means that there can be some inter-product variability. There are sometimes products that are supplements that even in the same bottle, you have a variation from pill to pill between the amount of active ingredient. Also, speaking of active ingredient, I should say this too. A lot of the studies that we have about valerian root, they didn't do a great job of sort of nailing down and pinpointing what dose should or should not be used, having a consistency of dose and things like that. So there's a lot of gray area with that. I should also mention. But remember that valerian root, just like any other supplement, could interact with other medications that you're taking or other supplements or vitamins that you're taking. I'm not here to say that this is any different than any prescription medication. I'm not trying to say that supplements and herbals are bad and prescription medications are good. No, I'm just trying to remind you that just like prescription medications can have side effects and can have interactions and things like that, so can herbal supplements, so can vitamins and things like that. And sometimes we forget that, which is why I point that out. That's a criticism I know that I get a lot in my videos is I think, maybe I don't do enough explaining that, like, when I give the cautions, it's not to say, oh, this is the worst thing in the world and medicines are great. It's to say, just understand that just like that there are cautions with prescription medicines, I also need you to know that there are cautions with supplements and things like that. And that's really what I mean. Okay. Glad I got that off my chest. All right. A couple other things I want you to know. In terms of sleep, I'd be remiss if I did not, before I left you, give you some insight into how to sleep better, because chances are if you're watching this video, you might be interested not only in valerian root, but also how to sleep better. So I'm going to do you a few solids. First of all, one of the things that helps me sleep intensely, like greatly, is I have this second YouTube channel that I don't really publicize a lot, but it's got meditations, and I create the meditations because it helps me with my anxiety. But I also have a playlist on this meditation channel that's just like sounds, ocean sounds, waves, things like that, because that actually helps me get to sleep. So it's weird. I listen to my own like secondary YouTube channel to help get to sleep. But anyway, I'll link it here. If you're watching on Facebook and you don't see the link, please write in the comments and I will try to get that to you. So just so you know. And then the other thing is I've got videos on like how to fall back asleep. I'll link those here. But just understand that, like, if you're in the middle of the night, you can't sleep in your bed, one of the best things you can do is get out of bed, go to another place like the living room, etc. Do something relaxing, and then when you're sleepy, get back to bed. It helps sort of dissociate your bedroom with the anxiety of like looking at the clock, being like, oh my God, I have to get up in 3 hours. Oh my God, I have to get up in 2.5 hours. Oh my God, like we've all had that feeling, right? So those are just a few things. I also have some videos on melatonin and stuff like that. Hopefully it'll help you. I'm not telling you can't take valerian root. That's not what I'm saying. What I'm saying is just understand some of these limitations and data that we have and some of the potential cautions, and then just make sure you are talking to your doctor so that they can help guide you and say, hey, if you're taking that, it could have a side effect with this blood thinner that you're on or this other thing that you're on, blah, blah, blah. Okay. So just keep that in mind. And then if you do take it and you've talked to your doctor, make sure you're not mixing this with other sleeping pills and stuff, because there is that theoretical interaction. Let me know what you think. Let me know if this is helpful. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos. Love y'all. Subscribe to my channel, please. Follow me on Facebook. I'm on TikTok, Instagram, LinkedIn, WhatsApp, and go to my website, drjencaudle.com, to sign up for my free health newsletter. All right, guys. Bye.